Hello friends, this is Dr. Gaware, interventional cardiologist from NM1 Institute of Cardiology. We are in the midst of a very bad COVID pandemic and we are really struggling. So it is very important to understand the comorbid conditions, and one of them is hypertension. Hypertension is one of the leading cause of death globally. Almost 10.4 million deaths per year and 1.89 billion people have been affected with hypertension. So don't take hypertension lightly. It is one of the most easily identifiable, reversible, modifiable risk factor for all heart attacks, brain attacks or stroke, atrial fibrillation or irregular heart rhythm, heart failure, kidney failure or chronic kidney disease, and peripheral vascular disease. It not only affects the elderly people, but it can affect the middle age, and not only that, it can affect young children and adolescents also. And that is why awareness of diagnosis and early treatment is very important. Another point to be noted here is the focus has shifted from the developed countries to the developing countries. The prevalence of hypertension is increasing alarmingly in the low to medium income groups rather than the high income groups, and it has been estimated by 2025 almost 1/3 of the world population will have hypertension. And that is why hypertension can affect multiple organs in the form of eyes, there is retinopathy, heart, I have already told you, it can cause kidney failure, it can cause peripheral vascular disease, and all this is preventable and reversible. The crux of the management lies in lifestyle modification in the form of low salt diet, diet full of green leafy vegetables, fresh fruits, and aerobic exercise in the form of 30 to 45 minutes of walking, jogging, swimming, cycling, that is aerobic exercise. And most important is, we see a lot of resistance to drug treatment in the younger population, but don't neglect hypertension, treat it early, prevent complications, and in this COVID era, hypertensives are at an increased risk of COVID complications, and that is why don't neglect your hypertension treatment. And it is like an epidemic to prevent. 2/3 of cerebrovascular diseases are because of hypertension, and half of the ischemic heart disease are also because of hypertension. So you can halt this cardiovascular epidemic by controlling such a simple thing as hypertension. So finally remember, it is not only a play of figures, it's a very, very important condition to prevent cardiovascular morbidity and mortality. So don't take it lightly, take it seriously, detect early, treat early, and prevent complications. Thank you.